Hi everyone, we are going to look at theories of tooth eruption. So eruption is the movement of teeth from the developmental position inside the jaw to their functional position in the oral cavity. So the theories of the tooth eruption includes root formation theory, bone remodeling theory, vascular pressure theory, and ligament traction theory. So the root formation theory proposes that the tooth movement in the axial or occlusion direction is mainly because of the formation of the root. So the contraindications include if root formation were to cause the pushing force for the eruption of the tooth, the root has to form on a fixed space. Only then can it exert a force in the opposite direction. In certain developmental disturbances, the teeth are rootless, but they still erupt into the oral cavity. There was also no direct relationship observed between the length of the root and the distance traveled by the tooth during eruption. Some teeth move a greater distance than their root length. An experimental intervention leading to stoppage of root formation did not cause failure of eruption, and experiments also demonstrated that a tooth still erupts even after the completion of root formation. So next is bone remodeling theory, which basically explains that the eruption takes place in a manner similar to the pre-eruptive movements. The resorption of the bone at the site of pressure and the deposition of the bone at the site of tension may cause eruption. So the pressure exerted by the growing tooth germ in the axial direction initiates the remodeling of the bone to create a pathway for the erupting tooth. Contraindication is that placement of a silica replica as a substitute to tooth germ with a dental follicle eruptive pathway was evident. On experimental removal of the dental follicle, there was no eruptive pathway. This shows that the bone remodeling alone is not solely responsible for tooth movement, and the dental follicle plays a vital role in the eruption of the tooth. Through subsequent studies, it was established that dental follicle conduits osteoclasts, which are responsible for bone resorption and also supplies bone forming cells. So next is vascular pressure theory, which basically suggests that the change in the arterial pressure of the surrounding vessels could be responsible for the eruption. Hypertensive drugs can cause vasodilatation. This vasodilatation can increase the hydrostatic pressure. Experimentally, this pressure was shown an increased rate of tooth eruption. Stimulation of sympathetic nerves can cause vasoconstriction. This vasoconstriction can decrease the hydrostatic pressure. Experimentally, this decrease in pressure was shown a decreased rate of tooth eruption. However, many investigators feel that this change is too small to cause a movement as large as that required for eruption. So next is ligament traction theory, which is the most accepted one, which states that the dental follicle periodontal ligament complex pulls the tooth into the oral cavity similar to traction. The support in this theory is that when a replica was planted in place of a tooth with the follicle tissue intact and all the other tissues removed, the replica erupted into the oral cavity. Further, it was shown that the drugs that interfere with collagen formation in the periodontal ligament interrupted tooth eruption. So this is a reference. Thank you.